primarily began about 5 years ago. We were one of the first trusts to actually go down the path of taking on board the ECDL, which is the European Computer Driving Licence, IT-based courses for our staff. And obviously CourseSource were involved in actually developing the portal for ECDL, and we found that about 500 to 600 delegates registered on ECDL, and they found one of the comments that they came back with was how easy the site was to navigate. So when we actually started thinking about e-learning, CourseSource seemed to be the opportune organisation to actually approach with regard to developing an LMS for us, a learning management system. I knew that they would actually develop a very easy to navigate site, having had experience of the ECDL site. But secondly was that every other e-learning that we actually had looked at that point was actually based on licenses. We had to purchase multiple licenses in order to get up and going. CourseSource afforded us the opportunity to actually purchase by module, and for us that was something that actually made us start, stand up and listen, because from the financial point of view, finances are constrained in the NHS, and we had to take finance into consideration when we were looking at a provider. I looked at all different aspects, the flexibility of the site, the fact that we could customise. That was another deciding factor for us. Everything else out there was very much off the shelf, and you actually went onto an LMS or an e-learning site that was actually didn't have your feel. And CourseSource actually said that they could customise the site to actually become the Bedford Hospital feel. And our strapline, for us, one of the key things is that our patient is critical to our organisation. Our strapline on our CourseSource e-learning portal is every patient matters. And to us that is critical. That's what we want to get out across to our staff and ultimately to our patients that we treat. It's actually taken off in a big way, and the feedback has actually been very, very positive. People that have actually done the modules are actually now more able to actually cope with their jobs on a day-to-day basis. One of the strands that I would want to actually develop even further is things like clinical leadership, which we don't have. We have many consultants who actually are in management roles, but they've never been afforded the opportunities for actually skilling themselves up on the management side. So one of the things that I've been speaking to Ken about is actually looking at what we could do on that front as well. Obviously we have all our mandatory courses, things like fire, manual handling, infection control. One of the big areas for us at the moment is safeguarding children and protection of vulnerable adults, as is the C. diff issue. I think that I certainly see it as a viable option. As I say, this was a course that was developed by another NHS trust many, many years ago, and we got to evaluate it and we purchased the rights to our own CD. But when I look at what's available on that CD, I think that it would actually be very, very useful for other trusts out there. Yeah, because linked into protection of vulnerable adults, again, there's this new legislation that actually very few people know anything about, and it links in so dramatically with protection of vulnerable adults. And I think that if we could have a course out there that actually deals, and it's an e-learning course, looking at Mental Capacity Act and upskilling people with the knowledge, I think that would help some way in them understanding the Act. I think that we would actually not have progressed as much as we have, especially with things like mandatory training, okay, and upskilling people. The typical example, if I may use it, is our generic skills induction. That's e-learning. It's not through the portal at the moment, but an example of that would be that we now rotate junior doctors 3 times a year, and the uptake, whereas before we would actually be recruiting 20 on each intake, we are now recruiting anything between 60 and 100 junior doctors to actually say that within 4 weeks of being in the trust, they have actually done 10 modules of e-learning because it's mandatory. We've progressed a long way to where we were at 5 years ago. Absolutely.